Hi, this is Dr. Donald Cann, C-A-N-N, dictating a follow-up note. Patient follow-up visit, diagnosis prostate cancer. History, Mr. seen for a yearly follow-up visit period. He states he's feeling fine. I had been a fixture here in the community for a long time. I really enjoy working with the patient population. Morning. Hi, Doc. How you doing?
Well, thanks to you, on Thanksgiving Day, I'm going to be 75.
The physician staff here is great, but more importantly, it's my team. Our radiation oncology department is not me, it's not our machinery, it's the team of people working there. From the person answering the phone, nurses, a technologist, some of whom I've worked with for 20 years. We're like a family there. That translates into great care. The patients notice that. Radiation oncology, it seems very complicated, but I think it is really basic. We use X-rays to treat cancer. If you irradiate cancer cells, they die from radiation, whereas the normal cells don't. If you give enough radiation, you can hurt a lot of cells. We can minimize the dose to the normal tissue while treating that tumor, but you have to have the latest technology. And I think if you go to a cancer center, it better be a given that they have the latest technology. We can take an image, the image we did the very first day we did the planning off of, and we have these volumes here that show where we're going to be treating, that will overlay that with the image today and show that it lines up perfectly. If it doesn't, we'll fine-tune it, adjust it. It'll move the table, and we'll make sure things line up exactly. And then once they do, and I give the okay, which I did, the technologist can just push a button, and the machine will move such that the patient is now in perfect alignment before they get the treatment. If you asked me 10 years ago, will we have the ability to do this? I tell you, I don't think so. And I think it's amazing technology that we can actually do a CAT scan right before the patient's treatment and do it all in 2 minutes, and the patient's treated immediately. It just really improves the accuracy of what we're doing. A big part of my role is to educate the patient and to let them make an informed decision about what treatment to choose. And when they do choose that treatment, to feel comfortable, they understand it. And I think a patient who comes here, they get to know not only the doctors, the nurses, the technologists, and we treat them like a person. We try to help them more than just treating their cancer. It goes well beyond that, whether it's their nutritional needs, their spiritual needs, and their financial needs to help them cope with this. Cancer is enough, but also having to try to pay the bills while you're out of work or your husband's unemployed. It's a scary prospect, and you need a lot of people on your team to help get you through this. It's always nice to see patients in follow-up who are doing well. I saw a patient who's now 5 years post-treatment for her breast cancer. It was an early-stage breast cancer, what might be considered a standard case, though it's never standard for that individual patient. She was lucky enough that we were able to pick up a second cancer, a much more deadly disease, a lung cancer. Because we picked that up early, she was able to be cured of that. It was important that we looked at the whole patient and looked at the whole situation, and we were able to pick up this other early stage disease, which actually was a much more serious illness. Very low likelihood she'll ever have any one of those come back. When patients complete treatment, they go out and they ring a bell out front. It's nice to hear that bell. It's a good feeling that someone's gotten through the treatment. To be able to get through this and be at 5 years, having beaten 2 cancers, that's miraculous. I'm always astounded when I see these patients.
Many of the patient care units in our hospitals have been modernized to provide our patients with comfortable accommodations while in the hospital. Our Dover facility, for instance, is the only hospital in the area to offer exclusively all private rooms to each patient. At St. Clare's Denville, the emergency department is in the final phase of a major modernization project, and our new state-of-the-art Bott Family Surgical Pavilion opened this past June.